All right. Good morning, everyone. First of all, thank everyone so much for joining us this morning on our webinar. My name is Shaquarius Jackson. I work with the Baylor Scott and White Wellness Team, and I will be your host today on our webinar. Our presentation today will be on osteoporosis and physical activity, and we will have a guest presenter with us today on our webinar as well. Before we get started, the first thing I want to say is that we definitely want you guys to be extremely interactive with us on our presentation as normal. I do like going over how to be interactive on the presentation as well. If you guys just take a few quick seconds and look down at the bottom of the screen, you'll see three bubbles down at the very bottom. Those three bubbles will have a chat feature down there. Utilizing those three bubbles is how you guys can interact with us in that chat feature. And then please put all your questions down there at the bottom. We won't have any like polling options or anything like that in our chat today, but as we're going through the chat features, you can put any questions you may have or comments as well. Throughout our presentations today, we are going to save all those questions for the end of the presentation today. So please, as you're going through your questions, if we aren't reading them during the presentation, I promise we will get to them at the end, but we do have a lot of content to get through. So we want to make sure we have time to get through everyone's questions during that time. Outside of that, again, thank you all for joining. I know it's kind of that lunch hour for all. So thanks for spending that lunch time with us. Kind of going and jumping into things. I'm gonna go and introduce our presenter that we have today. We have Dr. Hart, who will be presenting our osteoporosis webinar. Dr. Hart, if you just want to give a short overview about your background a little bit, and then we can get started with our presentation.
Thanks. I'm happy to join you today to talk about bone health and fracture prevention. So my name is Dr. Hart, and I am with the Health Plan. I'm an internist by training. Did advanced training for adults and a fair amount of work with the elderly in the past. And you'll see that that's important because it's an important risk factor for your risk of fracture as you age. But there's lots of things that we can do to prevent your bones from becoming more brittle and putting you at increased risk of breaking them as you get older. So we'll talk about them today. So if you would advance the slide, please, that would be great. So the goal here is to, it really 4 parts here is to help everyone understand what osteoporosis is. Some people might have heard the term, but not really understand what it means for them or the loved ones in their family. So we'll talk about how we define it. And then there are some symptoms and risks that people will fall into. And so we'll go over some of those so that people understand where, their risks might fall and how they might be able to develop some healthy habits to mitigate those risks. And then there's treatment and prevention options for osteoporosis. We won't get into a lot of detail around them because those are conversations you have to have with your personal physician. But I think that there are some, easy, low-hanging fruit that you can do before you get to, medications. And so would love to share those tips with you. And then, sort of the best practices for physical activity. If you do wind up either having osteopenia, which is bone loss, but not yet osteoporosis, and then more advanced osteoporosis. So with that, let's get started. Let's move on to the next slide, please. So let's start with what osteoporosis is. I already said, 2 different words. One is osteopenia. Penia means less. Osteo means bone. So osteopenia is when you have less bone, and it's the stage before osteoporosis. And so you can do a lot of things to prevent developing osteoporosis, even if you have less bone. So that's the great thing that we have some agency over. So, bones are living tissue. We don't really think about that very often, but they're constantly growing and remodeling. They get broken down. There's special cells that break them down and special cells that build them back up. Um, and and they are constant replacing the bone as you age and during development. So everybody knows how the bones grow and lengthen when you're, a child to a young adult. But then even after you've reached a young adulthood and you're at your like maximal height, your bones are still constantly adapting, growing, and those cells are turning over. Old cells are getting taken away, new cells are getting put in their place. And so that what we don't often realize is that it's a very dynamic situation. And so because it's a dynamic situation, we have we have the ability to harness some of that dynamic activity to our benefit by doing certain things. So, with that, let's move on to the next slide. So here are some general risk factors for osteoporosis. And, if you've ever had a family member or a neighbor or, a family friend that has developed osteoporosis, um, then you can, consider, what that looks like in your mind. But then when you reflect back upon yourself, one of the most important things, so in your head, you might have this image of somebody who had this broken bone and then the osteoporosis. And there can be this kind of disconnect. Well, this is where I am today, and that's not me. So it won't necessarily be something that happens like that. And it may not be, but you may have risk factors that you're not aware of that you can mitigate. And so, first off, like many things in medicine, is thinking about what your family history is. So if you've had people in your life that have had osteoporosis or had a fracture from osteoporosis. It's kind of classic to get a hip fracture from osteoporosis after a fall as an older woman, but you can also have other types of fractures. So if you have anybody in your family tree with those types of fractures, or they're taking medicine to prevent further bone loss, then that is certainly one risk factor. And having sort of an unhealthy lifestyle. And I mean, we could talk about this for many things, right? And so we could talk about it for heart health. We could talk about it for diabetes. We could talk about it for general wellness. But it also is pertinent to our bone health. So we'll talk more about that a little bit later, but if you're not eating the right things, getting good exercise, doing some weight bearing exercises, then you're at increased risk. And then some insufficient nutrients, and so that can be something that you don't really expect. So you need a certain amount of vitamins and minerals in your body in order to keep things functioning smoothly. And so traditionally, people who are very, very, very thin or have problems absorbing nutrients or have eating disorders, they can wind up with some insufficient nutrients. And so, or even gut surgery, like if you had your intestines operated on, or something like that, where they take out pieces, you might have an absorption problem. And so you can wind up having nutrient deficiencies, and the bones need the nutrients to keep themselves, healthy, well, and remodeling all the time. So, we talked about like too much, too thin and not enough nutrients. But there's also obesity as a risk factor. And obesity as a risk factor is complex, but really it has to do with the amount of stress that you're putting on your bones when you're overweight. Everybody gets a little bit more osteoarthritis when they have obesity for longer periods of time, and obesity can also, make it more challenging to have some of those healthy lifestyles. So it is a risk factor. And then there are several pre-existing medical conditions and treatments for pre-existing medical conditions that can be a risk factor. And we'll talk more about that. So next slide, please. Look at this slide. It's kind of a busy slide. Let's start all the way over on the right. So um, 30 years is the age when your body achieves peak bone mass, meaning that's the strongest your bones are going to be. And after that, there's this constant remodeling. But if you don't work at keeping your bones healthy and strong by having a healthy lifestyle, you wind up having some turnover and bone loss every year. But then at age 50, the turnover increases even further. And then any of you that are female and wind up going through menopause, once you hit menopause, some of the protective effects of estrogen on the bone, aren't available anymore. And so you can accelerate your bone loss once you hit menopause. So, up to 44 million Americans have low bone mass. So there's a lot of us that are at risk and could benefit from putting some of these more preventive things in their lifestyle. So let's look on the left side, men versus women. So there are three main kinds of fractures that are more common. Vertebral fractures, which is the bones going down in the middle of your back, holding your spinal column in place. Hip fractures, like I mentioned before. And then, this really thin part of your arm, the forearm, you can wind up having bone loss in that area. So those are more of the vulnerabilities. You'll see that those are outlined in each sex. And so in women, you can see there's a much higher number of those types of fractures. They gave you a rate, it's per 10,000 per year, but you can see that the rate goes up significantly once you get to about 55, which is when menopause is most commonly encountered, 54, 55. And then as you go up in time and age, you increase the risk of the hip fracture really stands out there. But the vertebral fractures also are high, but much higher in women than in men. And there are lots of reasons for that. They generally have higher bone mass to start with, and they have a lot more muscular mass. So that pulling on the bones over time, allows them to remodel, and it's a protective effect. Then, what the protective effect that women have is their estrogen. But then if their estrogen falls at menopause, then you see we go from, this sort of the same level, a little bit higher than men, but then really take that sharp turn up. And so what can happen is over 10 years, you can lose, a half inch every year. So that makes breathing more difficult. That makes mobility more difficult. You're stiff, you're uncomfortable. So next slide, please. So I want to just mention that one of the risk factors that we tend to forget about, and I just want to say this, that, you can um, have an increased risk of osteoporosis if you've had a prior fracture. So that is a conversation you want to have with your doc, right? If you've been in a big car accident and you've had multiple broken bones from it, then, or even just one broken bone from a fall skateboarding when you were 11, you need to go talk to your doctor about that and ask them if there's if you should go in for screening sooner, okay, than the standard recommendation. And we'll get to the standard recommendation soon. So next slide, please. Signs and symptoms, as you get more advanced, you start losing this height, and then your body sort of, leans forward. And when that curve starts happening, you kind of throw off entire the column is supposed to shape like this. And so if this exaggerates up, then the bottom part sticks out to compensate and keep you upright. And so you wind up having more low back pain from that. You can also, if the osteoporosis becomes very advanced, your the bones in your spine can break spontaneously just from the weight of your body. This melon here is about 8 pounds. And so keeping you upright, keeping your stability upright, keeping that weight in the right position is work that your body does for you all the time. You don't realize it. But then when your bones start having some of this problem with strength, then that constant forward pressure can hurt, sort of in the middle of the most common place to get those little spinal fractures, or sort of in that what we call the thoracic spine. So that part that is where the rib cage is. So you get spontaneous fractures, and then with this curving forward, people don't realize, but when they're taking a deep breath, they're not just using like their lungs a little bit up here, up by their upper chest. If you went for a jog and you needed to take a deep breath, you would lean forward and then take a huge deep breath back. So you pull back, you open up your shoulders, and you stick out your stomach when you're really breathing hard. If you're constantly like this, you can't take that deep breath. And so you wind up impairing your respiratory function because you can't move the big muscle in your diaphragm is right under your ribs. And so it pushes down when you're breathing. And it constricts the ability to push down if you're stooped over. Everybody could try it sitting at their desk right now, like, like this. Put your hands on your ribs and then breathe in. You can feel, and then you turn forward and you try to breathe, and you just can't move as much, right? So that's what happens over time. That's what we want to prevent. So next slide, please. So we'll talk about diagnosis, how to treat it, how to prevent it, okay? So how would I know? So, you might not have any symptoms. That's why we do a screening test for certain people who are at increased risk. We know from many studies who's at increased risk. And so that's medical history, seeing your doctor examining you, getting some imaging tests and some labs. Probably the most common imaging test is called this DEXA scan. I'll spend a little bit of time talking about that. And so what happens is you get a whole picture of your bones. They take measurements at your wrist, they take measurements at your hip, and they take some in your spine, just to see how porous the bone is. Porous means holes. And so you can see this picture here that the healthy bone has holes. But then as you develop osteoporosis, it gets more spongy looking, you know? And then it's severe or more advanced osteoporosis. There's not as much of the cells in between to keep the bone structure healthy. And so you could see that if you were to put stress on something, or these are just, there's nothing firm in the center there, then you could break this pretty easily. So that DEXA scan and the bone mineral density tests, they can help diagnose those. And then depending on what level of they find on the DEXA scan test, they'll recommend treatment or continued monitoring. Your doctor will do that. So I'm saying they because it's not me. So next slide, please. How do we treat it? So there's some things that you can do without your doc, right? You can do things to prevent, you can do things that are helpful. So, and then your doc can actually help you with medication. So things that you can do is to exercise, right? And it's part of that healthy lifestyle as we were talking about. And so, exercise with, you know, walking is a weight bearing exercise. Most everyone can do it. I always recommend to everybody that they walk. Um, and other weight bearing exercises like actually doing some weights, like some actually pumping some iron. And it doesn't have to be a lot, but having that puts extra stress on the bone, not too much, right? But some extra stress on the bone. And by forcing the muscles to work against the bone, it allows them to do that remodeling. Okay. Of course, they can remodel, but if they don't have good nutrients, then they're not going to be able to build the bone as strong as they would if they had good nutrients. So, all of the things you always hear. So, lots of green leafy vegetables, fruits, whole grains, like a very balanced diet, would be good. Some calcium is in like multiple vegetables and also in dairy products if you can take that. So very important to think about those types of things. And then, you can take calcium or vitamin D supplements. You'd have to make sure you talk to your pharmacist about what's the right dose for you. There's some adjustments if you have problems with kidney stones or you have kidney disease. You always want to stop by and talk to your pharmacist, even for over-the-counter medicines. If you have a illness, a chronic condition in any way, and just say, hey, can I talk to you? I'm thinking about taking this one, especially those of you with kidney disease. I'm thinking about taking this one. Is this okay? I have kidney disease. And they'll talk to you about it right there. Over the counter doesn't always mean that you can take it as prescribed if you have a chronic illness. And of course, you can always call in and talk to your doctor or their nurse. And then there's medications and hormone therapies that can be given, both oral and IV therapies. And usually there's a staged progression of, like, your osteoporosis is at this level, we'll try these things. And then if those things don't work and we scan the DEXA and things are getting worse, then we change the treatment. But we always try the things that we know work well. And then if they're not slowing it down, allowing your body to rebuild, then the treatment advances from there. Okay, next slide, please. So for prevention, so this, like I said, we screen for this. So at age 65 or younger for women with certain risk factors, so fractures in the previous, um, and and 65 in general for most everyone else. They recommend having a healthy diet, do weight bearing exercise, getting calcium and vitamin D. And it doesn't need to be a lot of vitamin D. There was some positive press about vitamin D within the last few years, and some people took that to one extreme and started taking mega doses of vitamin D. Um, Vitamin D is a medicine that your body doesn't clear as easily as other medicines. I mean, you make it, right? You make it when you get out in the sun. Um, People with darker complexions don't make as much. When they're in the sun. And so, that's why you see vitamin D is fortified in milk so that when children are growing, they have as much as they need. But I would caution you not to take too much of vitamin D. Again, talk to the pharmacist before you buy that over-the-counter supplement to make sure that it's the right dose for you. In general, like a 1,000 or 2,000 for most people is fine. But if you start taking higher doses than that, your body can't get rid of it. It stays with you and it stores in your fat cells. And so it's very important not to take too much. Doesn't mean you shouldn't take it if you need it, but just be, aware of what you're putting into your body and consult with the experts so that you know what works for you in your condition. So next slide, please. So physical activity. It's so underrated and so amazing for us. So next slide. So increase strength, you have improved balance. I mean, walking helps, but walking is a two-legged exercise. So anybody who's sitting at standing at the sink who wants to work on their balance a little bit while they're, doing that last little bit of dishes, pick up one foot. You can lean against the counter, pick up one foot while you're doing it until you're tired, and then switch to the other foot. That will help you with your balance, and it's something you can incorporate in with your usual activities. Of course, you can do more, you can do yoga and other things like that will really help you with balance. And weight training actually does help with the muscle strength, but if you're averse to weight training, it isn't something that interests you, walking is a weight bearing exercise, so that helps. So it helps decrease your risk of bone fractures because you're helping your body remodel. Those bones are remodeling. They're taking away the old stuff, putting down fresh stuff, and you have better posture. Your breathing is easier, and then you have less pain. So of course, we would advise you to always talk to your doctor before you start any exercise program because you have to personalize it to your own personal health situation. So, okay, next slide, please. So strength training, upper back. And when we think upper back, like think those muscles and underneath the shoulder blades, there are special exercises that can not just do your shoulders like this, but pull in and do your shoulders like that so that the muscles right along that spinal column stay strong, and that you get good posture. After we all sit at the computer for too long, you'll see anybody who's had a computer job for too long, their shoulders are rolled in a little bit, even me. So there's a series of corrective exercises that you can do to put your shoulders back, so that you have that strength and that posture. Obviously, we've been talking about weight bearing flexibility exercises, whether it's a stretching routine, some light yoga, some more intense yoga if you're interested in it, things like that. And then stability and balance exercises. One of the things that I think works really well for stability and balance, if there's anything near you or you want to do something online, is Tai Chi. Tai Chi, I think they even have some online sessions where you can sort of practice the movements. And so those, you put your foot out forward and the other back and you shift your weight. Those are all great stability and balance exercises. So even if you can't get to a class, if you do have the internet, you should be able to find some things that are nice, and reasonable, price-wise. So next slide, please. So here's some of the safe exercises you can do. This march in place, put your hands to the ceiling, right? And then up and down like this. And then, you can just hold some water bottles, various amounts of water in there to do that. You can walk, you can do knee lifts, you could do hamstring curls. So all of those things can be done even throughout your workday, to prevent some of these things. If you're just doing your 5 minutes standing up every hour, that helps. But if you do your 5 minutes standing up every hour while you're at work and you sneak in some of these, even better. And then walk at night or on the weekend. All right, next slide, please. So, the risk assessment really has to do with, with what your nutrition looks like, what your personal risk factors are, whether you're on any medicines that can contribute to osteoporosis. Sometimes if you have a problem with your thyroid, a problem, with other hormones, like if you osteoporosis and menopause link that I mentioned, and other hormones such as a parathyroid hormone, which regulates the calcium in your body. So there are a few different things, whether or not you're taking medicine like prolonged courses of steroids also um, can have a negative effect on your bone strength. So you want to, when that history and exam happens, those are the types of things you should be reviewing with your doc when you talk about your personal osteoporosis risk. Next slide, please. Of course, want to remind you that there's many resources available for you on the member portal on that, and you can access through the app. So with that, I think we're near the end. I was wondering if anybody had any specific questions that I could help with.
How about taking vitamin D versus vitamin D3?
Yeah, I think so. If you have a normal kidney function, as not the over-the-counter vitamin D would be fine. If you have more advanced like renal disease, then you might want to be thinking about normal vitamin D versus vitamin D3. Yeah. Thank you so much then. It was wonderful to talk with you all today. I hope that we've given you some ideas about what you can do in your usual day to sort of work on your balance, work on your strength, and continue to strive for the healthy life we all deserve. All right. Thanks again.
So, and thank you as well, Dr. Hart, for providing your time to us today and for the great information you gave us on osteoporosis. We definitely appreciate it from the wellness team, and then from all the participants that got on as well, for the presentation. For everyone that did get on, as a reminder, we do these presentations monthly, and we love bringing in presenters like Dr. Hart who do have specializations in these areas.